Although thousands of patients each year have facelifts without major complications, complications can and do occur. The severity and frequency of these complications vary depending again on the surgeon, technique, and medical health of each particular patient. Your surgeon should highlight your individual unique risks during your consultation. Patients who smoke or have specific health problems have higher risks. It is wise and often required to have your family doctor perform a thorough medical checkup prior to complicating this procedure to optimize your health and your results. Again, facial plastic surgery is generally safe, and many clinical studies describe the rate of these individual risks at approximately 5% or less. Nonetheless, you should be fully informed of potential risks while keeping in mind the relatively rare occurrence of these complications.
If you are watching this video, you may have already considered the alternatives to having facelift or browlift surgery. When applicable, these may include changing your present diet or beginning a new diet program, changing your exercise routines, or possibly addressing a current medical problem. Consideration can be given to the benefits of chemical peels, laser resurfacing, creams, injection or different fillers or injectables in the skin, and various promoted techniques to tighten the skin. Facelift and browlift surgery are elective surgical procedures, and if you choose not to have them performed, you will avoid the risks associated with the procedure. You should consult with your physician about available alternatives other than a facelift. A hematoma is a collection of blood under your dissected facial skin which could develop after surgery. It usually can be evacuated with a very small procedure if it occurs, with no impact on your final result. This is a photo of a hematoma immediately after facelift surgery. In the middle of her cheek, you can see an isolated area of swelling, which is a collection of blood under the skin. Often, the hematomas are larger than this, have associated bruising, and may occur anywhere where surgical dissection has taken place. They usually require another surgery to drain. Although asymmetry may be noted as a complication, careful examination of the face reveals asymmetry in everyone. Your surgeon will never be able to make both sides of your face look exactly the same. They never really have been anyway. More obvious discrepancies are possible, however. Poorer scarring than expected, changes in the color of some of the dissected skin, and even areas of hair loss can result from surgery. These problems can be quite noticeable and ultimately limit the choice of hairstyles you wear. So, the location of the incision should be carefully discussed with your surgeon. You should also be careful not to expose your incisions to sunlight until your doctor lifts this restriction. Excessive sun exposure, the first 3 to 4 months on a healing scar, can cause increased pigmentation of the scars. This is an example of a problematic scar behind the ear from facelift surgery. An inaccurate estimate of excess skin and poor planning for the incision has left this patient with a bald spot and a break in her natural hairline behind her ears. Unfortunately, she will not ever be able to put her hair in a ponytail without feeling very vulnerable and uncomfortable. The correction for this problem often requires hair grafting techniques. Be sure you discuss with your surgeon your scar locations and related hairline issues. This is a photograph of a patient who has had a previous facelift and now has a formidable problem. Again, an inaccurate estimate of excess skin and poor planning for the incision has left her with a tremendously displaced hairline, which is almost impossible to conceal, especially if the wind blows. This makes her look much older than she is. The flashing line represents where the incision was placed, within the hair. The dotted line represents her original hairline, which has been pulled back unnaturally to the location you see it in front and in back of the ear. A well-intended attempt to hide the scar within her hair was not a good choice. This hairline deformity is a much more difficult problem to conceal and usually requires hair grafting techniques to improve. Be sure to discuss these issues with your surgeon. Infections can occur with any surgery, however, they are usually rare with facelifts. If the healing skin has a more severe compromise of its blood supply from excessive tension, an infection, bleeding, or generally poor tissue qualities, a portion of the skin could die or slough. This rare event seems to occur more frequently in patients who smoke. It usually involves an area of skin behind the ears and will require a longer recovery period or a revisional surgery. Perhaps one of the worst complications would be damage to a nerve that controls some particular sensation or movement of your face. If a sensory nerve is damaged, You could have numbness in areas of your face or ear. If a motor nerve controlling movement is damaged, you may lose the ability to move that portion of your face. With brow lifts, this may be the ability to raise an eyebrow. With facelifts, this may affect movements around the brow, eyes, mouth, or lips. Usually, in this rare event, the loss of feeling or movement will only be temporary, but it could be permanent. Generally, there's a higher risk of experiencing nerve damage if a deep plane technique facelift is performed. There is a chance during and after surgery that blood clots can develop in the lower extremities. Rarely, these blood clots can travel in the bloodstream to the lungs. This is called pulmonary embolization. These events can lead to the need for hospitalization and occasionally shock and death in the most severe instances. Precautions taken during surgery, such as placement of compression stockings, significantly lower the risk of this rare complication. A return to activities such as careful walking soon after surgery also decreases these risks. It is extremely important to go over these and other risks with your surgeon and have your general health evaluated. The amount of time a facelift lasts varies tremendously. Obviously, the old removed skin will never come back. However, your existing old skin will continue to age and sag over time. A facelift will not arrest the process of aging, but you will continue from a more youthful place than your current state. Immediately after surgery, your skin will be pulled tight. The skin always settles some, however, as the effects of gravity and animation continue. This is similar to when jeans are taken out of the dryer and worn. They are initially very tight, but loosen up by the end of the day. Your facelift should make you look naturally younger, more rested, and hopefully it will be 10 to 15 years before you will want another one. Although complications are infrequent, they do occur with any operation, and a facelift is a surgically sophisticated and complex procedure. Other complications could occur and possibly lead to permanent deformities, the need for revisional surgery, hospitalization, and even death. Be sure to carefully discuss these risks with your surgeon and the possible related financial responsibilities. The time it takes to perform a facelift varies among surgeons based on different techniques, differences in the anatomy of the patient, and the extensiveness of the individual procedure, among other reasons. This should be discussed with your surgeon. Facelifts are safely and frequently performed under both general and local anesthesia. With a general anesthesia, you are completely asleep and your breathing is controlled by the anesthesia provider. Under a local anesthesia, usually you are sedated and the areas to be operated on are made numb with a series of injections. Post-operative instructions also vary among surgeons and should be very carefully followed to increase the likelihood of a favorable result. Be sure to keep all scheduled post-operative appointments so your surgeon can monitor the healing process and evaluate for the development of any potential complications. The recovery period also varies greatly depending on the technique utilized, particular surgeon, and the patient. Usually, the recovery from a facelift is not a painful one. The skin on the face is actually numb until the sensation returns. Bruising and most of the swelling should resolve within 2 weeks, allowing you back to work by then. It may be 4 to 6 months, however, before you really feel that you have completely healed. Usually, exercise or vigorous activity should be avoided for 4 to 6 weeks. Your healing incisions should be kept out of the sun, or at least covered with sunscreen for 3 to 4 months to allow better healing. Your surgeon will outline a unique recovery plan for you. It is often a great idea to spend a night or two in a recovery facility or under the care of a nurse. This will add some additional safety, comfort, and convenience for you and your family. Frequently, small drains are placed during surgery under the skin on your face or neck. These will collect any additional fluid or oozing to help you recover faster with less bruising. They are usually painlessly removed 1 or 2 days after surgery. This is an example of a drain that might be used. The tiny little tube is carefully placed underneath the skin and drains into a bulb outside the body.
One word of advice in regard to these advertised facelifts, which you recover from in only 1 or 2 days. Chances are that either you do not need it, or the procedure you are paying too much for is an inappropriate shortcut that is truly not what was as advertised. The following video segment follows a patient who had a facelift, brow lift, eyelid surgery, as well as dermabrasion and laser resurfacing around the mouth. You can follow each area of interest before and after surgery.